Warm greetings of the day to all the audience present here. So, today I'll be talking about a very essential topic in radiology that helps us to understand about the contrast media, its types, uses, and so contrast medium is a substance used to enhance the visibility of internal structures in imaging procedures like X-ray, CT scan, and ultrasound and MRI. Many organs in our body, such as blood vessels or soft tissues, look similar on like normal scans. Contrast agents helps by increasing a contrast between this structure, making it easier to detect abnormalities. There are different types of contrast media. Firstly, we have iodinated contrast agent, and it is like used in mainly used in CT scans and X-rays. They contains iodine, which absorbs X-rays and highlights blood vessels, kidneys, and other organs. As non-ionic forms are safer and cause fewer allergic reaction. And third, second, we have barium sulfate. It is a positive contrast used to study the gastrointestinal tract, such as in barium swallow or barium metal studies. It outlines the esophagus, stomach, and intestines. And third, we have gadolinium-based contrast. It is used in MRI to improve the soft tissue visualization, especially for brain, spine, and tumor imaging. And lastly, we have ultrasound contrast agent. It contains tiny microbubbles of gas that enhance blood flow visualization and help assess organs like the liver or heart. And its uses in radiology, as it is widely used in many diagnostic procedures to visualize blood vessels in angiography and CT angiograms, to detect tumors, infections, or blockage in organs, to evaluate the GI tract for ulcers or swallowing disorders, and also in MRI to differentiate between normal and abnormal tissues. And it also have precautions, even though contrast media are generally safe, but patient safety is the top priority. So always check for allergies, especially to iodine or gadolinium. Access kidney function before giving contrast since it's excreted through the kidneys, and ensure proper hydration before and after the procedure, and keep emergency drugs and equipment ready in case of allergic reactions. And most importantly, communicate with the patient and make them feel like comfortable. And to like contrast media are very powerful tools that enhance the diagnostic value of medical imaging. Understanding their types uses and their precautions is essential for every radiologic technologies to ensure accurate imaging and patient safety. So now I'm going to share you a very important, very essential research paper, as it is written by few of the radiographers, and this research paper is titled as safe use of contrast media. Safe use of contrast media, what radiologist needs to know. It is a very interesting topic, a very interesting research paper, as it helps us understand very crucial things in radiology. So here it is. So this research paper focuses on the use and safety of contrast media in radiology, particularly iodinated and gadolinium-based agent, as I already talked before. These contrast media are used daily in radiology departments to improve the accuracy of imaging and diagnosis. They are generally safe and effective when administered properly. However, this research paper highlights that adverse reaction can still occur and sometimes may be life-threatening. That's why it's crucial for radiology staff to understand how these reactions happen and how to manage them properly. Now, focusing on the important part that as it is highlighted out there, the paper emphasizes that radiologists must be aware of the latest understanding and strategies to reduce the risk of renal dysfunction caused by contrast media. It mentions that one of the significant adverse reaction is nephrotic system fibrosis (NSF). It is a rare but serious skin disease linked to the use of certain gadolinium-based contrast agents, especially in patients with chronic renal failure or kidney failure. This condition causes life-threatening and hardening conditions of the skin and can even affect internal organs. The research stresses the importance of knowing which type of gadolinium agent pose a higher risk and when it's necessary to withhold this agent, particularly in patients with poor kidney function, as it is a very essential topic. This paper serves as a very important reminder that while contrast media play a very vital role in diagnostic imaging, patient safety should always come first. Radiologists must stay updated on safe uses, understand possible complication, and take necessary precautions, especially for patients with kidney problems or those at higher risk. So now I'll be sharing you a very interesting book titled X-ray Contrast Media Overview Use and Pharmaceutical Aspects. It is a book by Aldrich Speck and it is also very interesting as well as a very essential topic. So here here it is. So it also highlights some very important topic. And so this books mentioned that the importance of contrast media was actually recognized almost at the same time as the discovery of X-rays themselves. This means that from the very beginning of radiology, scientists understood that X-ray alone are not enough to clearly visualize all the internal structures of the body. You see, many organs and soft tissues, such as the intestines, blood vessels, or kidneys, do not naturally absorb X ray very well. Because of that, mm, they appear very faint or even invisible on a normal X ray image. To solve these problems, contrast media were developed. These are special substances that can be introduced into the body to make certain structures or fluids more visible under X-ray. So contrast media help to highlight or bring out areas that would otherwise be hidden, allowing radiologists to get a more accurate and detailed image. The book also explains that over time, a lot of effort has gone into improving both the contrast agent themselves and the techniques used to administer them. The goal has always been twofold. First, to make images clearer for diagnostic purposes, and second, to improve patient safety and comfort. With the advancement of imaging technologies such as computed tomography and digital subtraction techniques, the clarity and contrast resolution of X-ray images have become even better. But even with this technological development, contrast media continue to play a vital role in modern imaging. They are still used in widely in combination with these newer modalities to enhance the image quality. Now, the book also talks about the function and uses of contrast media, particularly in terms of visualization and morphology. In visualization, contrast agents helps to study processes like like elimination, for example, how the kidneys or liver excrete substances, and transport process like the flow of blood, movement of cerebrospinal fluid or intestinal contents, perfusion, which means the blood supply to various organs, and permeability and barriers such as the blood brain barrier, or cyst walls. All these functions allow radiologists to understand how well an organ is working and detect abnormalities that might not be seen on a plain X-ray. The term morphology refers to how contrast media help in creating and increasing differences or contrasts between various tissues. This can be achieved by using different concentrations of contrast agents, or like barium sulfate solutions in these contrast media tests. Next, the overall overall, this section highlights how essential contrast media are to diagnostic imaging. Without them, many of the fine details inside the body would remain invisible, making it much harder to identify diseases or assess organ function accurately. So, as we already learned, it is very important, and this contrast media truly revolutionized medical imaging from the early days of X-ray discovery to today's advanced CT and MRI scans. They have remained a cornerstone of radiologic diagnosis, improving image clarity, helping detect diseases earlier, and ensuring the patient receives the right treatment based on accurate findings. So now I would also like to share you a case study video by case study video titled Contrast Agent in X-ray and CT Scan You Need to Know. And it is also one of the very essential case study in radiology, and here it goes.
All right. Red Nation, today we're going to talk about contrast agents in X-ray and CT imaging. What are the different types of contrast agents? How are they used? Make sure to stay to the end to see some misnomers or things that a lot of people still believe that aren't true about contrast agents. So contrast agents are adding material in order to increase the anatomical contrast in your X-ray and CT image. It's that simple. It's just something that we add to the body while we're taking the X-ray or the CT image, such that we can visualize the anatomy more easily. And there is inherent contrast in your X-ray images, especially in bony anatomy. You can really see the contrast very well. You can see high resolution structures very well in the bony anatomy.
So here it displays introductory visuals of a medical imaging equipment and a brief animation showing an X-ray and CT scan in action. So the contrast agent, it highlights that contrast agent used in X-ray and CT scans today. Will explore what contrast agents are, how they work, and why they are essential in medical imaging.
Because of the relative high Z of the bony anatomy, right? In lung cancer, for instance, you can see that very well. There's very good contrast in your X-ray imaging between background of more air-type tissue and cancerous tissue in the case of lung cancer. These are two cases where there's good inherent contrast in your X-ray imaging. In order to improve the contrast, you have to change the X-ray attenuation. You can either change it in a negative manner or change it in a positive manner. So first off, we'll talk about changing the X-ray attenuation in a negative manner. And that can be done especially well by using air or by using carbon dioxide. Air and carbon dioxide both have a very low X-ray attenuation. They're relatively low Z and they're low in density. So those are both things they're going to mean they're going to attenuate your X-rays. you don't see x-rays of the brain that often anymore, but an x-ray of the brain would look something like this. Back in the day, before there was CT, we would actually do an exam that would actually add air, essentially, to displace cerebral spinal fluid, and you could then get better contrast within the brain using this negative contrast agent by using air. This was a really...
So here he compares between the two images here, X-ray of the brain and X-ray of the brain with a wrong contrast media. He also talks about the lung infections, lung pathologies, and conditions that is very rare and very life-threatening. So he talks about the contrast agents are the substances used in medical imaging to enhance the visibility of the internal organs, blood vessels, and tissues.
gruesome exam in terms of the side effects. This exam is called pneumoencephalography, and it is not done anymore. Nausea could go on for some time, and throwing up, being disoriented. Luckily, CT nowadays gives us better contrast in this, which I'll show you in just a minute. But this shows you an example of using air as a contrast agent. The inherent contrast that we have on our CT exams significantly better than what we saw on X-ray. And you can see on a non-contrast CT of the head, you can see a lot of the soft tissues. You can see that cerebral spinal fluid. You can see the white matter. The white matter is right here. You can see the cerebral spinal fluid here in the ventricles. You can see a tumor here. In the case of blood, you can see blood from the relatively recent bleed, all with the inherent contrast of a CT. This is the case where you don't necessarily need contrast for certain types of tasks if there is a recent...
So here he demonstrated very well inherent contrast, while he also referred it by demonstrating it by the image. So he displays the image of the brain with brain image with contrast media. There are several types of contrast agents used depending on the imaging techniques and the part of the body being examined. So the administration of contrast agents can be done orally, intravenously, or rectally depending on the type of scan and the areas of interest. Proper administration is crucial for effective imaging. And while contrast agents are generally safe, they can cause side effects ranging from mild allergic reaction to more severe effects in rare cases. As as I already showed you in a video, also the wrong contrast media could be a very great problem later on. It's important for patients to discuss their medical history with their healthcare provider before undergoing a scan with contrast. So, contrast agents, like I already said, it plays a very vital role in medical imaging by enhancing the clarity and detail of X-ray and CT scans. Understanding their use and safety helps patients and healthcare providers make informed decisions about imaging procedures. So now I would like to share you a short lab demonstration video by myself of the barium sulfate solution, as it is very crucial to detect, to visualize the internal organs like stomach and esophagus and intestines. So here it is. So warm greetings to all. Welcome to my radiology lab demonstration video. So today I am going to talk about the most common procedure, that is barium sulfate examination. So in this procedure we'll visualize esophagus, stomach and upper part of the small intestine. So here we have a barium sulfate solution. It is kept safely in the cupboard. As you can see, microbar powder. It is also referred as microbar powder. So In barium sulfate test, so we visualize the organs by using this contrast agent called barium sulfate. So as the patient, for this test, patient drinks this barium sulfate and it coats the lining of the esophagus, and we'll be able to see the movement and shape of the esophagus. And this test is very useful to diagnose ulcers, tumors, reflux, and also swallowing disorders. So before the procedure, the patient is asked to fast for 6 to 8 hours, and as the patient drinks it, we as a radiographer capture the real-time image of the barium swallowing through the esophagus and the pharynx. So after the procedure, patient is advised to drink plenty of water, and they may also notice white stool for a short period of time due to this barium sulfate. Thank you for watching my video. I hope this demonstration finds you well. So here it is a very essential, very interesting topic I've covered. It is a very common in radiology, a barium sulfate test. As I already said, it is also referred to as microbar powder. So the patient drinks it and it coats the lining of the esophagus, and it allows us to see a clear visualization of esophagus, its shape, movement while swallowing it. As I also talked about how radiographers advise the patient to fast before the procedure 6 to 8 hours, and like as the patient drinks it, we will be capturing the real-time image to find the accurate abnormalities in the organs like esophagus, pharynx, stomach, and upper portion of the small intestine. In this video, I have demonstrated a very important topic: contrast medias, its type, uses, and also the precaution. The safety measures are also very essential for contrast media. So I hope this video helped you a lot, and as this is a very essential topic in radiology. Thank you so much.